How does social media affect your mental health and well-being? I'm Chad Swanson. I'm an emergency physician, and I'm on a journey to understand and transform our health system. I was on a walk earlier today with my grandchildren, and it was a beautiful day, having a great time. And the three things that you can do together that might be the highest yield, highest leverage for improving your health is exercise, connection with others, and getting outside. And I was doing all three. But I found myself thinking about and kind of pulled towards my social media accounts. So I'm trying to post a video every day on YouTube and on TikTok and other channels. But I found that activity was pulling me away from kind of what I want most out of life, and that's just to enjoy a beautiful day with my grandchildren. So I wanted to check in with you. Do you find that social media has that effect on you? I know it does on many. I've been influenced by the work of Jonathan Haidt. He's, as I understand, a social psychologist, used to be at Yale. I think he's at somewhere in New York City now, but he's written a book recently, The Anxious Generation, and is advocating for more understanding around the effect that social media has on us, especially the youth, and has spread research that's been done on this topic. So here is a graph that shows the prevalence of anxiety in the United States. So in 2008, about 8% of, and this is, let's see, so you can see here the 18 to 25-year-olds, about 8% reported anxiety in 2008, and then close to 20% in 2022. And then I'm an emergency physician, so girls aged 10 to 14 in 2005, 2006 there were about 100 per 100,000 population, and that went up to 600 per 100,000 population over the course of those years. So there's been a significant increase in the prevalence of anxiety and in the number of young people, especially young ladies, that are coming into the emergency department for self-harm. Now, there could be, of course, a number of potential factors contributing to that, but Jonathan Haidt reports that it's his belief that this is due primarily to the use of smartphones. And that's my experience as well. So as I've raised my children and interacted with young people, and then just my own personal experience. So what I've decided to do is only check social media 3 times a day. I haven't been very good at doing that, but that's one idea that I've had. Some family and friends have shared other strategies that have been effective for them. One is a phone called Brick. Now, I have absolutely no connection to Brick whatsoever. This is not an advertisement. It's simply a product that family and friends have had success with. I've never used it, but it's a phone that you have to be close to some type of electronic activator or something. So you can put the activator in your basement or something, and you can only check certain apps if you're close to that device. I think it looks like a little brick. So I might get that, I'm not sure. Again, no connection whatsoever. Some have said that it's effective to take icons off of their phone so that they can't automatically check those apps. And then there are phones out there that are only used for phone calls and texting and things like that. That might be effective as well. So I'd like to know what your experience is. How does social media affect your mental health? What are your strategies for setting healthy boundaries around that? I would think that in an ideal system, so as I think about our vision of optimal health and well-being for all, I could imagine maybe a weekly meeting. It could be virtual, it could be in person, but between medical clinics, public health professionals, university professionals, and community representatives who follow this data and say, look, back in 2008, 2011 or something earlier on, we might have noticed that there was an increase in anxiety. We might have noticed, maybe emergency physicians like myself mentioned that we're seeing more young people coming in with self-harm. And then we could start to think about, is this possibly due to smartphones, and could we act in a way that could be effective for that? Jonathan Haidt has 4 recommendations for a more healthy relationship in young people with their smartphones. Number 1 is no smartphones before high school. Number 2 is no social media before age 16. Number 3 is phone-free schools. And actually, our schools where I live are starting to ask parents how interested they are in approaches like this. And then finally, more independence, free play, and responsibility in the new world, or in the real world. So in an ideal health system, the clinic, the research professionals in universities, public health professionals might work more frequently together to address local health problems in a way that more rapidly addresses the problems that we have in our health. And that would require our institutions, the organizations that we have, to be more nimble. It would require new incentives and new relationships. So I'd like to know what you think. Thanks.